The meeting is now live.
Okay, thank you very much. Again, good morning everybody and welcome to this morning's Health and Wellbeing Board meeting. I'm having some technical issues here myself, unfortunately, but hopefully everyone else is okay. My name is Councillor Jason Fazackley. I'm Cabinet Member for Health, Wellbeing and Social Care and also Joint Chair of the Health and Wellbeing Board, and I'm chairing today's meeting. Members of the public are invited to view the meeting and there's been the opportunity of written representations to be submitted. Can I ask members to keep their microphones on mute until I need to turn these on when they wish to speak? If we're going to use the chat function, can members please note to indicate their name to speak and no other comments? And you can access chat from the horizontal menu bar, right click to bring it up and not the icon on the left hand side. Can I ask everyone taking part to confirm they are present? What I'll do is I'll go through the list that I have it. I'll ask if you're present. If you can just confirm, and I'll carry on. I'm already aware of some apologies. Okay, so the list that I have here, can I ask first of all, Dr. Linda Coley?
Hi, I'm Dr. Linda Coley, Clinical Leader for Health and Care Portsmouth and Joint Chair of this board.
Thank you. I'm next on the list, so I'm obviously here. Councillor Vernon Jackson?
Sorry, it's Susie here. He might be hot-footing it. We've just been at another meeting that's run over a bit, so he's probably on his way over.
Okay, thank you, Susie. You're next, so Councillor Susie Horton.
I'm here. Thank you.
Thank you. Councillor Lewis Gosling.
Morning.
Thank you, Lewis. Councillor Kirsty Mellor.
Good morning, everybody. I'm here. Camera off today. I've got a poorly Leo, so apologies for that.
Okay, thanks, Kirsty. Councillor Jeanette Smith.
Morning, everyone. I'm present.
Thanks, Jeanette. Jo York. Jo, are you there?
She's likely to be a few minutes late because she's running late from a meeting that's just finished as well, Chair. You'll be joining us shortly.
Okay. Maggie McIsaac.
Chair, Councillor Jo York usually represents Maggie on the board.
Okay. She will be here. Helen Atkinson.
I'm present. Thank you, Chair.
Thanks, Helen. Diane Sherlock.
Hello, Chair. I am present. I'm CEO of Age UK Portsmouth and one of the representatives for the voluntary sector. Thank you.
Thank you, Diane. Susanna Rosenberg.
Yes, I'm here, Chief Operating Officer for Solent NHS Trust.
Thank you. Jackie Powell.
Good morning. I'm here, a lay member for Portsmouth CCG. Thank you.
Thank you, Jackie. Last few, Superintendent Claire Jenkins.
Morning, everybody. Yeah, Claire Jenkins, District Commander for Portsmouth Police.
Thank you. Roger Batterbury.
Thank you, Chair. I'm Roger Batterbury, Chairperson at Health Watch Portsmouth.
Thank you, Roger. Gordon Blund, sorry. Gordon, are you there? Okay, he's not here. Francis Mullen. Okay, that's all. Have I missed anybody?
I'm here, Chair.
Oh, Dave, yes, you're down. Councillor Ashmore, yeah, you're down for an item later on, so you're not actually one of the board members, but
no.
Okay, thank you for your presence.
I'm here anyway.
Okay, and obviously Anna Martin, our Democratic Services Officer, is here too.
David Goodsey, the Chair of the Portsmouth Adult Safeguarding Board.
Okay, thank you. Make sure you're added.
Morning, Jason. Andy Biddle.
Andy, thank you, Andy. Could not miss you.
Hi there, Hayley Barrington. I'm representing Sarah Beattie for the Probation Service.
Thank you.
And Kelly Nash from the Strategy Unit.
Good morning. Okay, I think that's everybody. Thank you very much. If we can move on to declarations of interest. Does anybody have an interest they wish to declare? Can I also say, if you may need to shout out to me because this phone that I have here is only showing me a limited amount of screen. So if I miss anybody, just jump in. Sorry again, this is not ideal. Any interest? None that I can see. Okay, so item 3, which is minutes of the previous meeting. We need to ensure this is a correct record of the meeting held on the 22nd of September this year. Are there any comments, first of all? Nope. Okay. Do I have a proposer for the minutes?
Jason, I'll propose it. It's Roger Banterbury from Health Watch.
Thank you, Roger. So, Roger, we have as a proposer. Do I have a seconder?
I can second. Jeanette.
Thank you, Jeanette. Okay, the recommendation has been proposed and seconded. I'll now take the vote by affirmation of the meeting as permitted within the regulations. If there's no dissent, the proposal is passed. Are there any objections to the recommendation? Nope, nobody. Okay. The minutes of the previous meeting have therefore been agreed and approved. Matters arising. Does anybody have any matters arising from the last minutes? I'm not aware of any, but nope. Okay, there are none from anybody. Before we start the main business on the agenda, I'm aware there's a lot happening in the wider health community, and it will be of interest to members of the board. So I'd asked Joe York and Andy Biddle to give a brief update on developments and invite any other colleagues to comment if they so wish. So, as not sure if Joe's here yet, Andy, you obviously are here. Can I pass over to you to start? Thank you.
Yes, of course. Thank you, Jason. So this was an update, and happy for other colleagues involved to chip in, really. And I see Joe's there as well. Morning, Joe. So what we're going to do is a brief update to talk about the current pressure in the Portsmouth and South East Hampshire system, which, as you know, is the collection of health and care agencies and other partners clustered around the acute footprint for Queen Alexandra Hospital. We've had a focus for some little while now, probably I think the middle of October onwards, or the beginning of October, middle of October onwards, around the number of ambulances being held at the trust due to the difficulty with being able to safely transfer patients from ambulances into the care of the trust. And that's linked very strongly to the occupancy within the trust, which runs at the moment usually well above 95% occupancy. The Portsmouth and South East Hampshire system, in this case comprising the Hampshire and Portsmouth councils, Solent and Southern community trusts, CCGs, Hampshire and Isle of Wight, Hampshire, Southern and Isle of Wight, CCG and Portsmouth CCG, and our colleagues at Portsmouth Hospitals Trust have worked together on a plan which has been submitted through to NHS England to start to make inroads into that number of ambulance holds and try and manage down and completely eradicate ambulances being held at the trust. Obviously, that's been a great concern in terms of from our SCAS colleagues being able to respond to fresh calls in the community if they're queuing at the hospital. So what I was going to do very briefly was just outline the plan for people and ask others to jump in if they wanted to give any more detail from that. It focuses on 5 main areas. The principle is to think about preventing unnecessary admissions and conveyance to the hospital by ambulance, to look at the processes that go on between the front and back of the hospital doors, and then to consider what more can be done to manage safe discharge. So those are the 3 principles the plan's founded on. And the points of the actions within that to create a new emergency care centre within QA in the emergency department, to design to see people who walk into the emergency department and seek treatment that way. And this is up to 60 people per day, started mid-November, and frees up a seated area in the emergency department majors area to be used as a surge area for the ED, and that increases their capacity by 12 spaces. In addition to that, there's a modular ward being planned, which is currently scheduled to be open in mid-December at the site to further increase the capacity in the emergency department. Part of the efforts to work on processes within QA was to look at an initiative called Same Day Emergency Care, SDEC, also linked to a medical village concept, whereby people are seen and treated on the same day that they're presenting to the hospital and therefore don't have to be admitted, still working on that admission avoidance principle, and ensuring that there's the right clinical expertise within that unit to be able to, or within that concept rather, to be able to make rapid decisions on turning people around if they need alternative resources or giving them the treatment they need so that they don't need to be admitted. In addition, there's a team called the High Impact Team, the HIT, and they're a multidisciplinary team based at the emergency department with a comprehensive knowledge of community resources. So as people come into the department, if there are other options for them, they can be diverted out of the department back to those options if they need care and support or healthcare and support access. And again, impacting on admission avoidance to keep the footprint in the hospital down. There's also the facility for an increased use of the clinical assessment service, so that people can be seen by a GP if they're at risk of conveyance to the hospital, and to assure a clinical assessment before that conveyance, and increasing the access for GP appointments to the 111 service, and the appointments at the Unscheduled Treatment Centre at St Mary's, again as an alternative to directing people to the emergency department. And then in terms of discharge and working at the back door of the hospital, increasing discharge to assess beds within the community, both through Solent NHS Trust and through the City Council in terms of units that we already run and operate, to increase beds available to discharge people in a more timely way from the back door. But also to look at the facilities that we have in the community, particularly for Portsmouth. That's the rehab and reablement team, to increase their spaces so that they can see more people and pull more people out of the hospital. That also includes thinking about the therapy provision that we have in the community, and seeking increased domiciliary care. As you know, there are issues with recruiting domiciliary care at the moment, but we're trying to work with all of the providers that we know to try and increase that care availability, again in pursuit of a timely discharge from the back door. That's a broad run through and a quick run through of the plans as they've been framed currently. We do know there continue to be risks within the Portsmouth and South East Hants system, and they are risks that are national, in that we are seeing an increased use of emergency departments. We are seeing difficulties in recruiting staff into both health and social care. We know that we're coming into the winter period where it won't just be a COVID impact this year because of the increased mixing of people. We will see the occurrence of more regular diseases such as influenza, which has an effect on NHS capacity. And we are still, of course, dealing with the COVID-19 pandemic. The difference between this and last winter in terms of COVID is the rate of vaccination within the community that has decreased the severity of COVID for the vast majority of people. But there are still a number of beds that are occupied in QA and in most of our major hospitals by people, excuse me, needing healthcare because they have COVID, or by people who've been admitted for other reasons and then contract COVID whilst they're in the hospital. Joe, that's a very brief run through. I don't know if you wanted to add anything else.
No, I think you covered all of that extremely well, Andy, and just shows how closely we are all working together, and apologies for being late. So no, I think I'll wait unless people have got questions and can perhaps pick up any specific details people want in the questions, if that's helpful. Thank you.
Thank you, Joe and Andy. Can I ask anyone got any questions they'd like to bring to either Joe or Andy after that presentation? Jacqueline, I have a few first of all.
Yeah, first was to say a huge thank you to everybody who's working so hard on this, because I can see it and you can hear it. And I really value that, actually. One of the things I read in one of the reports is about hourly sprints, and I wasn't sure what that meant and how that's part of the package.
The hourly sprints tend to be sort of an internal improvement improvement program within the trust. So it's a short-term, sharp way of making those changes and to run a sprint, which helps them to improve processes in quite a quick way. So it's something the trust have used for a while to really just help staff create some of that space and capacity to make some improvements. And particularly when they've got flow issues, it can be really helpful to move things through more quickly. That's the idea of the sprint approach.
Okay, and has it been proven to be helpful as part of this bigger package?
Yeah.
That'll do. Thank you, Joe.
Okay, thank you, Joe and Jacqueline. Councillor Smith, I have you next.
Yeah, thank you. How does this, what you've just described, fit in with a Better Care Fund plan? And is there extra pressure on funding to change the plan to the way that it needs to be done now? Because budgets is coming up, and I'm concerned that money-wise we can't afford it anyway.
Okay, so that's quite a tricky question. So in terms of risk to the council budgets, I don't think there are any additional risks to the council budgets. Andy will sort of correct me if I'm wrong, but that is my understanding. The Better Care Fund has always been about trying to reduce admissions to hospital and to enable early supported discharge and to reduce admissions to long-term care institutions like care homes. So it's absolutely focused on these issues. I think what's helpful is a lot of our work through the Better Care Fund and the way we operate, particularly in the city, means that we have those joint services and that joint approach to funding, which means we can flex. So one example of that is our long-term plan around the Southsea unit, and to create that as an integrated discharge to assess unit through sort of consolidating other sites and through the intention to close the Jubilee House site to consolidate on that service on the Southsea. That's our long-term plan anyway. What we're seeing is that, and that was from April next year, subject to all the approvals, what we're seeing actually, because we've got that long-term plan in place, we can actually enact that more quickly and recruit the staff to, increase, to go up to the 40 beds in Southsea unit in advance of that long-term plan. And Solent are keeping capacity at Jubilee. So we've created that additional capacity. Again, we can use the Better Care Fund and the NHS investment to support the council with that. And there's no very limited financial risk to the council in doing that. So that's one example very practically of how we're speeding up our existing plan and using that the additional funding through the hospital discharge fund to do that. So there's no financial risk to the council.
Okay, thank you.
Andy, I don't know if you wanted to add anything to that.
I was just, in fact, you answered it in the last bit because you said the hospital discharge fund. That was the only thing I was going to add. So you'll be aware, Jeanette, we have the hospital discharge fund confirmed with us until the 31st of March next calendar year. So it won't currently be in the new financial year. And so that's enabled the CCG and the City Council to have some detailed negotiations on occasion, but to have some negotiations about how we manage at-risk funding and work together to try and to be part of this wider plan and bring those plans forward. So that was the only thing I was going to mention.
Okay, thank you both. I don't have anybody else that's indicated to speak unless I've missed anybody. Speak out now if you wish to say. Okay, there is no one else. So Joe and Andy, thanks for the verbal update. Much appreciated. Can I ask we move on now to item 4, which is the local engagement board update. That's pages 9 to 12 of the agenda, and we have Kelly Nash, corporate performance manager, presenting that report. Kelly, over to you.
Thank you, Chair. So this is a very brief item and is the usual report that brings to this board the activity of the local Outbreak Engagement Board, which is a subgroup of this board set up to oversee the COVID response locally. And summarises the activity since the last meeting that's taken place in that board. So the two probably key points of note since the last time that we met is that firstly, the local Outbreak Engagement Board have now agreed a new local outbreak management plan for Portsmouth. That was signed off in the September meeting and takes account of the autumn winter plan and the most up-to-date containment framework. So that's been set out for the area, and that sets out our local response in respect of things like test, trace and isolate, and also vaccination programs. So it brings all the information together in one place. Of note also is that at the last meeting, the board did discuss the findings of the recent Joint Select Committee report on lessons learned from COVID response so far nationally, and that was at the request of Health Watch that we did consider that. And I think we had helpful discussion around there, which sort of flushed out that the local response has very much been a case of balancing that national policy framework against where we feel there's a particular local intervention that would be useful, and including things like very targeted vaccination programs. So there's a bit of a discussion around that, and I think that was really helpful. So not a lot else to say really. It was agreed the board would continue to meet on a monthly basis while we're in this period of response, and that's really, really helpful. And I know that there are other members of the board here today who may well have comments, so I don't think anything additional to say in terms of the information. This report is brought as an information report just to keep the Health and Wellbeing Board updated of activity. As I say, others on this board may want to comment. Thank you.
Thank you, Kelly. Does anybody else wish to comment or any questions on the report? No. Okay. As it is only an information report, we don't need any formal recommendation to it. So just thank you for that, Kelly. Moving swiftly on, Kelly, it's you again. Health and Wellbeing Strategy, pages 13 to 36 of the report, and also Matt, if Matt's present, but I can't see him.
Yeah, thank you, Chair. I think actually maybe Helen might have a couple of words to say in introduction, then I think Matt will take us through a presentation.
Okay. Helen?
Thank you, Kelly. So the board will be very, very familiar with the work that has been underway to refresh the health and wellbeing strategy. So Matt's going to take us through a short presentation, really setting out, you've got the document, had a chance to have a look at it, but really what we're asking for today is for the board we're really seeking agreement from that board to progress to the wider consultation on the strategy with the objective of completing the refreshed strategy in February 2022. So there's a few asks of the board there, which are to agree the content of the document, which can then move on to consultation. We do want to discuss and agree the board level leads for each of the priorities. If we don't complete that today, we will obviously work between now and final publication on that. But anybody that's we're always looking for keen volunteers from board members to be champions for each of the areas. Obviously to support the recommendations from the Chief Medical Officer's recent report into health outcomes in coastal communities, which listed Portsmouth as one of the areas for local action, agree the process for the consultation, and finally agree the final document when it comes back in February. And with that in mind, I'm going to pass over to Matt, who's going to do a presentation. Thank you.
Thank you, Helen. Thank you, Chair. So Matt Gummerson, I'm the strategic lead for intelligence in the public health team in Portsmouth. Presenting the strategy here, but I should say very much this is a team effort by a number of people who've contributed both to the development of the strategy and running workshops and working on the document itself. So I'm very grateful for all the support of all of those who've contributed to get us to this stage. So I'm going to take you through 3 slides, but really they just summarise what's in both the report and the draft strategy that you've all got copies of. So some of it will be quite small in terms of the wording on the screen, but all the wording is in the documents that hopefully you've got in front of you and had a chance to read already. If you give me 1 second, I'm just going to turn my camera off to save bandwidth. Hopefully slides should be on screen for you now. As Helen said, the recommendations that we'll go through, we'll pick up again at the end, so I'll run through the content and hopefully that'll get us to the point where we're able to agree the recommendations. If you've got questions, I'd be grateful we take them at the end. So the background, just to make sure everyone's kind of on the same page, because we've been doing this for a while, as Helen said. You started looking as a board at this in early 2020 in terms of understanding what might be driving a number of areas where Portsmouth performs relatively poorly, what we call the causes of the causes. What are those things that underpin those poor outcomes? And you agreed as a board that you wanted to focus on really shifting the curve on those issues, so taking a slightly different approach and a longer term approach to the strategy. We looked at this again in July this year, in light of the pandemic and things that have changed over the preceding 12 months, and you agreed 5 underlying causes: poverty, education attainment, housing, air quality and active travel, and positive relationships. And we then ran a series of workshops during the autumn to develop the detail that then is set out in the strategy that you've got as an appendix. And then so we're back asking for approval for the consultation. The next slide is just a reminder, it appears in the document, just a reminder that the health wellbeing strategy is very much part of that wider ecosystem of integrated activity around health and care, and also our wider partnerships, so including community safety and the Children's Trust Plan. It's a key part of that process, but our aim is not to duplicate work that's already happening elsewhere in the system, but to really think about where, as a board, you can add value to that work by driving through key system-wide changes over that longer term. Now, pressures of time in getting the report ready from the workshops meant we weren't able to share the kind of worked up version of the strategy, so you've just got the Word document there, but I can assure you that Mark Maguire and the council and his team have done a fantastic job of turning that into a proper looking strategy. I've just grabbed a couple of screenshots of it just to share on the screen now, just to give you a flavour and assure you that work has happened. It's all the content as per the Word document, but just with a bit more work to make it visually appealing and readable for the wider public. So the version that will appear online once you've approved it, subject to any changes you make today, will look something like what you can see on screen now. So section 4.5 of the report highlights a number of cross-cutting themes that emerged through the workshops. They are picked up in the specifics of activity around each of those pieces of work, but they came up in common in pretty much all of the workshops, and we felt they were worth drawing out as cross-cutting themes. And what we're suggesting is there's something that you may want to revisit as a board in future meetings, and think whether there's additional work as a system that we need to be looking at. So community development came out in all of the workshops. The key, and I know we've highlighted it in the strategy, this needs to be about working with local people, local groups, empowering our communities to prevent the need to use public services, as well as changing how public services are delivered. That commitment that's embodied in the Hive Portsmouth, that was so essential during the COVID-19 response, really needs to be something that we build on in all of our activity in delivering the strategy. Likewise, issues around equality and diversity that were again highlighted during the impact of the pandemic on different communities and various other social movements and changes that have happened or been brought to the fore over recent years, and really just highlighting that deprivation is just one of the persistent inequalities that impact people's ability to fulfil their potential. So again, we need that to be something that we address through all of our priorities. And the last one, around that link between sustainability, climate change and health. Again, I think we'll recognise that the pandemic has been a huge challenge. The climate crisis is likely to be a huge challenge for us as systems going forward, and we need to take the learning from the pandemic and use that to really think about how we can shift to being more resilient as a system in everything that we do. So those three were we felt sufficiently important to be worth drawing out to the board's attention, and I think something that we might want to look at as a board in the future in a bit more depth. The next 5 slides then take us through each of the priorities. I'm not going to go through them in detail. You've all got the strategy in front of you, and everything that's on screen here is in the priorities in that strategy. But it was really just to reiterate that this is what's been developed through the workshops. We had around about 100 stakeholders attended the workshops, representing a broad cross-section of partners and organisations in the city, and really came up with some rich content to shape this. And as before, when we presented this to you, there's a kind of section at the start explaining why it's an issue, why we need to address it at a systemic level in order to improve outcomes across a range of measures. There's some highlighting some key short-term activity in each area that will be the focus. Reference to the related partnerships and plans that are already there in the city, But what we're really looking at for is that kind of commitment at the board level to thinking about the things that you can do or influence, use your kind of power as anchor institutions in the city to make a difference on. So the first one, tackling poverty, the key thing I think that came out is that if we had that shared commitment across all local public services around helping people to escape poverty and mitigate the effects of poverty, one way in which we can collectively do that is by continuing to provide, enhancing how we provide good quality employment that tackles in-work poverty. So if every employee that we can influence in the city had received a real living wage, had security and sufficient working hours to meet their needs, the ability to work flexibly to support those with additional needs or responsibilities, and opportunities to progress into and through work, that can make and already does make, but could make more of a huge difference to the influence of poverty in the city. So that's the kind of thing where we think as a board we'd be looking for you to provide that leadership, and when we get a strategic lead at board level, they'd coordinate the kind of an annual report to the board, which they'd look for all partners to contribute to say how we're working towards meeting that goal. So it's not about kind of a tick box of saying have we hit X or Y target. It's about understanding what we can all do and how we can make those kind of changes that will drive improvements in levels of poverty in the city that will therefore over the longer term improve health and wellbeing outcomes. Second one, educational attainment. Again, the strategy highlights the work that's already going on in the city, the ongoing challenges that are faced, and then some areas where we think further work and attention could add value. So it's around supporting schools to provide the best educational experiences and supporting children and families to get the most out of that learning, and some key ways around to do that, highlighting the importance of investing in the early years and supporting families in pregnancy and young children to get the best start, but also developing that citywide culture of aspiration and expectation, which is something that we think as system leaders you've all got a role to play in delivering. Positive relationships. We had a really engaged and interesting workshop around this, and there was a real buy-in across the city to the idea of growing what we call relational capital, so people's kind of ability to engage and have positive outcomes through the relationships that they have, and the importance of restorative approaches in addressing that. So really looking for a kind of a board level commitment, if you like, to making Portsmouth a restorative city and adopting restorative approaches in a number of ways, building on fantastic work that's already going on. And then there's a number of kind of targeted programs that we're looking to work with, but also changing the culture, giving permission for staff to find the right solutions for clients, regardless of which agency they approach. That kind of no wrong door idea that I know is already being taken forward, but how we can embed that in all of our work. The work on housing, which was highlighted by yourselves as an area that you wanted to include in the strategy, and at the time I think we were all keen to really understand what the role of the board can be in relation to issues like this, and the workshop was really good in taking forward some of those issues. It is still a challenge because some of the issues are long-standing, so we set out in there the kind of fact that there's a significant proportion of the city's housing stock, for example, that's over 100 years old, and the challenges that lies, and there's where we can add value in that is limited, but also recognising that will continue to impact on health outcomes, not least with energy prices currently soaring and the potential for that to lead to high fuel bills, and then the kind of eat or heat dilemmas and impact that will have on people's health and well-being. So key areas focusing around continuing to support the homelessness and rough sleeping strategy, taking a accommodation first, not accommodation only approach. So that area is about saying that we need to not just get people off the streets, but provide them with the support they need in terms of developing plans that enable them to sustain housing and that will have a huge impact on health. Highlighted there, I mentioned earlier about inequalities not just being about deprivation, but thinking about specific communities. Our homeless population die on average 30 years younger than the rest of the population, and that's an outcome that we all need, I think, to focus on addressing in any way we can. But also then working on how we can develop models of housing that suit people at different stages in their lives and reflect their needs. And I think there's support for the board can offer in terms of helping the system to understand the future needs that people may have, and how we can all work to get people thinking about those needs and working out how to meet those needs in advance rather than when they become a challenge. And lastly, active travel and air quality. Again, I don't think I need to highlight to the board, but the impact of poor air quality on premature deaths, the impact of obesity on a range of health outcomes, and the fact that we still have, it says in there, only 5% of trips in Portsmouth are cycled, and only 18%, so less than 1 in 5 of total kilometres travelled in the city were walked, which, given the positive impact walking can have on people's health and well-being, and the nature of our compact and flat city largely, I think is something that we can certainly look to improve. So the focus really there is ensuring that we as a board, you as service providers, think about whether your services are reducing air pollution and whether you're promoting active travel in all ways. And also going back to that question around equalities, are there areas where you need to provide additional support for those who experience greater barriers to taking up those kind of opportunities? So that's a very quick run through the priorities, but I think we have rehearsed the issues with yourselves as a board a number of times, and people, as I have contributed to the workshops representing you and your agencies in developing these priorities. So I hope they're suitable and something that as a board you can get behind. The last section is around delivery, monitoring progress and measuring success, and what we've talked about doing is recognizing that these are complex issues. They're going to take longer term efforts. It's not about taking a kind of outcome measurement reporting every quarter or every year and saying, what directions are going in, because that really won't necessarily tell us that much. What we're looking to have is a combination of things. Firstly, as Helen said, a lead for each priority, a board level lead. There are operational leads for these that have led the workshops, but we want someone to be the board level sponsor really for this work. It's not about you being responsible for delivering the work. This requires work from all of us, but about providing the kind of focal point and leadership to bring something back to the board each year with support from officers in various agencies, explaining how we're addressing the issue and really challenging one another about whether we're doing all that we can on those, and thinking about, as I say, roles as anchor institutions. I just pulled out on the right hand side a quote there from Toby Lewis, who's I think led integrated care systems elsewhere, did a really interesting blog on the King's Fund recently around the role of anchors and anchor institutions that I thought really resonated in terms of what we're looking to do. It's a different way of working. It's not about how you allocate budgets to meet a specific target. It's about your role as leaders, backing what's already in the community, the action that's already out there that just needs that profile, that energy, that additional facilitation that big organisations and leadership teams can provide in terms of connecting the community and doing something different. So I just thought it was a kind of good way of expressing what it is that we're hoping to achieve. The second thing we want to explore is an idea called principles focused evaluation. So it's about taking the kind of calls to action that we've set out in the strategy, turning them into principles. So this is saying we will do this, which I think ties in with the work you previously looked at this board, which we used to kind of loosely refer to as the sort of Wigan deal approach, which is around that kind of social contract. We will do this. We expect people to do that. And then, it's about saying, are we meeting those principles rather than have we delivered X or Y within the last 3 months? And then lastly, the ONS Health Index, which I haven't talked about here, but it is in the strategy because it's something we've talked about before at the board, provides that kind of objective framework for taking an annual long-term look about whether the collective efforts we're leading as a board, you're leading as a board, are addressing the overall health of the city. So we've got a baseline from pre-pandemic and an annual process for assessing whether it's making a measurable difference over time. But but it will require you as a board to hold your nerve, I guess, and recognise that you're setting out strategy for the next 5 to 10 years, and we need to stick with this work and not pick it up again in a year's time and decide to do something else if we're going to really make a measurable difference over time. So I've talked a lot, gone through a lot of things. Hopefully, I've covered all of those things, with the exception of, and I do apologise, in the background slide, said at the bottom, that section right at the bottom of this slide, that there will be obviously further research needed, new things that emerge, one of which that we've highlighted is the recent Chief Medical Officer report on the health of coastal communities, again looking for the board to support that strategy and its suggestion for further research into the health needs of coastal communities. I think something that we'd all recognise is required. So I'm going to stop there and say happy to take questions on any of that, but hope that we can, after discussion, agree the recommendations as set out in the report and on screen now.
Yeah, hi, thank you, Helen, particularly Matt, for that detailed explanation there. It's obviously important for us as a board to take the lead, and I think the presence of the people here today is a sign of our commitment to that. And the recommendations in the report are obviously furthering those aims. Before I ask for a vote on the recommendations, can I ask for any comments or questions? I've got Councillor Smith and then Councillor Horton so far. So, Jeanette, over to you.
Yeah, it's more of a comment, really. I think it's an excellent strategy, and it pulls together everything that I'd want to see in a strategy moving forward, especially for the Health and Wellbeing Board, and then it incorporates the city vision and everything else. So it is a really comprehensive strategy. But I do have a worry, and the worry is, and I'm only speaking for the City Council here, I can't speak for NHS or anybody else, but we need to have high level buy-in to this to move it forward. If we don't get that buy-in, it will just wither on the vine and be like any other strategy that we've ever done, which is then sort of shelved. So I would like some commitment from the administration, but also the chief exec, to that this is a plan that we are going to move forward on and incorporates all the other plans to make sure that we are doing things differently, and that does mean a culture change. And we haven't been successful in that in the last 23 years I've been involved with the council. So hopefully this will kickstart that into that culture change. Sorry, I'm a bit grumpy.
No, don't worry, Jeanette. Thank you for that comment, and we'll come back on that. I have lots of other hands going up now. I'm also having some IT people here bringing in a temporary laptop, so I may come online in a second. But in the meantime, Councillor Horton, over to you.
Thank you, Jason. And actually, I'm really glad I'm following Jeanette, because I am sympathetic with her. But actually, I've got a little bit of optimism, Jeanette. So one of the things I wanted to pick up on was particularly this speaks to the bit about ways of working and principles focus, because I agree with Jeanette. So many strategies I have been involved in over the years, not just in Portsmouth City Council, but in organisations, seem to become separated from the day-to-day and the actual experience of people in them for all defendable reasons, but it's about how do we bring this in so it becomes at the core of our day-to-day working. So we're not doing something in a project-like way, but we're actually doing it because that is the ethos that we work in. And I particularly wanted to focus on the restorative and relational practice, because when I first got involved with the council, I was told that we had aspirations to be a restorative city, and I still think that that is there, and obviously it's coming up in this strategy. I just want to give you a heartwarming example. I went to a school yesterday that's really, really not bought into this. They live it. They've made their whole philosophy of education has changed, and they use restorative practice and relational based approaches to everything. And I went in the school a few years ago and I went back yesterday, and it is really transformational. But I'm going to give you one anecdote, which is what I think demonstrates this strategy into practice. There was a young lad there yesterday who talked about being excluded from another school because he had a short fuse, that's his words, he had a short fuse, and that he'd got himself into a cycle of being in trouble in school, which meant he was in trouble at home, which meant he was more angry, which meant he was in more trouble at school, and that what had happened at his school was through relational and restorative conversations he'd managed to break that cycle. That's life changing, and that will give that child all of the tools that they need to have a healthier life, and we know that. And so when I was listening to the presentation, I was feeling a little bit what Jeanette was saying. It's like, how can we make sure that this happens? And I think anecdotes like that are really important. And my final point on this is what I think shifted that school and can shift cultures is our examination of language. The children, the young people that we met yesterday, and they weren't all handpicked because we could pick our own as we went round. What I noticed was their command of language around making themselves safe and healthy. So I'm sorry that was quite an extended example, but it was very good timing, because we don't want this to be a strategy that we refer back to at an annual point. We want it to be embedded, and I think we can do that with small changes if people are committed. Thank you.
Thank you, Susie. Don't apologise about your contribution. Always delightful to hear your voice. Jacqueline, you're next.
Just really wanted to support the other two speakers in what they're saying in making this a living, breathing thing. And I think this is a great document. I really like it. I would like to see it embedded. My observation probably is a little less heartwarming, is around that we're being 113th out of 149 in terms of children's social and emotional mental health. And that's just a bit of a sobering thought. And it also, I found it heartwarming, Susie, what you were saying. My experience as a young person's counsellor, is especially around attainment, is that sometimes they're trying so hard within the schools, it seems to me that the young people are not motivated by the pressure, but it can be counterproductive. So that relational stuff seems very, very important, as I speak to quite a few young people that are absolutely immobilised by the pressure to attain and the pressure to be at school. So I just think we need a little bit of awareness. And that led me on to things like, I'd like us to be a city that looks at lifelong learning, because another thing that comes out is young people's thoughts. If they haven't got it by age 15, they're stuffed. That's it, their life over. And the thought that there is actually lifelong learning that we encourage in the city seems really important and should be part of, I think, this package. So I think, and given the depth and sort of the response to all of this, I was surprised that the survey is over quite a short period of time. You've got over Christmas and just into the new year, which I don't know if that's enough time to get the kind of quality of survey response that we'd like. That was it from me. Thank you.
Thanks, Jacqueline. That's a valid point, actually, I think, about the survey time, whether we can look at changing that, and maybe someone can come in and give me some advice as to whether we can extend the time somewhat. We'll come back to that at the end. I've got Joe York down next. Joe?
Yeah, thank you. Really agree with all the things the other speakers have said, and Councillor Horton saying around the children in schools and living some of this and seeing that then bear fruit in the changes in individuals is so important, isn't it? And we have to, I think, hold on to that and recognise that it is more than just a strategy that sits on a shelf. It's about how we all operate in our roles and the difference we can have. And I'm very conscious that we haven't got as many of our NHS provider partners around the table today as we usually have. That, I think, is because of the pressure that we're seeing at QA, and so is understandable. But I think this strategy is so important to getting us out of that position, and sometimes I guess it's hard to see the link between the two, but actually it is about the causes of the causes and tackling poverty and thinking and working with the NHS and the NHS as an employer, and it is a big employer in the city and nationally, how it's not just about providing care to people and offering care. There is more probably that we should be doing to look at, have we got workforce strategies that can tackle poverty and that enable young people from the surrounding areas into work in the NHS, and are we doing enough around that? Sorry, I've got and again, things like the air quality. We talk a lot about ambulance conveyances, how we deliver care can impact on the environment as well, but also are we looking at that? So I do think there's something that this is so important. It's so embedded and will impact on the health of residents in the city that we really need to be committing to that with our NHS provider partners, and for them to think about how they can operate as employers, as those anchor institutions into the city. Again, I think probably picking up on Jackie's point around the consultation and the survey, is there enough time at what is always a traditionally really busy time for the NHS over the winter? But I wonder if as part of this consultation and again getting that buy-in, because they're not here today, that we use the Portsmouth Provider Partnership to again get them to think about how they can sign up to some of these things and sponsor it as part of the board, because they're not here today. So just thought that might be helpful, but and I'm really committed to supporting the board to have those conversations as well, if that would be helpful.
That was helpful, Jan. Thanks for the enthusiasm over that. I have Matthew. Matthew, coming back about the survey, or are you coming back about another point?
I was just going to answer specifically on that point, if that's helpful.
Yes, by all means.
So I think there's two things. Firstly, in terms of the public consultation around it, obviously we could extend it, but it would mean that we wouldn't be able to approve the health wellbeing strategy yourselves as a board, the final version, until June, when your next meeting after the February meeting would be. So it would leave quite a long gap before we then have the strategy in place. And we do work closely with our colleagues in the community engagement and insight teams at the council and take their advice. And I think if you extend the public consultation via the website by another month, it's not going to significantly change the numbers of responses that you get. I think the important thing, building on the discussions you've all already had, is this shouldn't be a strategy that sits on the shelf. There should be a kind of ongoing process of engagement where we're talking to communities, organisations about how we work together on these things. And to me, that's where we'll get the richer input rather than an online consultation to a document, which is never, I don't think, always the best way to get people engaged in it. So it's the work that we do, as Joe was describing, with providers, with communities to see how we do things differently, that I think is probably more important than how long they're able to respond to the online consultation would be my view. Just as an example, there's a restorative practice event in, I believe, the Guildhall. I think it's this week actually. The public are invited to. That will be a great opportunity to engage people in discussions around the positive relationships priority, more so than responding to the document, which probably speaks more to people like us than to the wider public.
Okay, well, thank you for your thoughts, Matt. Jacqueline, you raised the concern. Are you okay with that? Can you see the point behind it, or would you rather still seek whether members want an extension?
Well, actually, Matt's kind of answered it, is the other mechanisms that we have to engage with people and making sure that's promoted out there. And I guess it's like, if we are going to do a survey, we may as well do a survey in full, if you see what I mean, rather than see it as like a tick box exercise. But if there are other ways of engagement and getting that feedback that feels far more meaningful, I'd rather hear about those, actually, if that's okay.
Okay.
So
yeah, fine, thank you. Yep. Unless I've missed anybody, I can't see anybody else on my screen. Is there anybody else that wishes to come back? Andy, is that you?
Yeah, thanks, Chair. I wouldn't disagree with anything anyone said. I think the commitment piece is an interesting one, and I take the point about strategy sitting on the shelf and have many moons of experience of that as well. I guess if we don't really have a lot of choice, I think, and I'll be a bit parochial from a health and care perspective, if we don't change the relationship that we have with our health and care services, then our health and care services will be completely overwhelmed, I think. If we look at the numbers that we see around, taking just one thing like obesity, and linking it to the active travel stuff that Matt was talking about, you know, the limited amount of folk that are walking in a fairly compact city, we know the damage that does to people, to their long-term health and to their long-term independence. And this is a document as it is currently, but is actually more of an approach and a concept that talks about engaging our city. And, you know, using our staff to engage our city. Most of our staff live in our city, are having a really clear understanding, using really clear and focused research about what we all need to do to take care of ourselves so that we're taking care of our future, and giving the right lessons in terms of a lifelong journey with our own health and care and our own responsibilities. And I think we'll be stuck in the loop that we're in currently, which is the overuse of acute services, unless we can get to the point where we can make this thing live, this thing come off the page. I think we've got a massive opportunity in terms of positives, because we've got a clear commitment at a city level from all sorts of organisations to work together, not least the health and care organisations. And we're trying to make sure that stays post ICS, so that we can support the ICS with a really positive model of working as a community, working at a sense of place. And I guess the last couple of points, I think so much of what we do as public institutions fits in with this. We are working for the public. We are trying to help people to help themselves. We're trying to improve people's lives and help them improve their lives. And so seeing the work that we do as part of this strategy, rather than necessarily this strategy being something else, I think is really helpful. And that links to communications, that links to sharing this in a really accessible way, not only with our citizens, but with the staff in all of our organisations, and having it as a clear aspiration. And those comms are really key, because if you can get 3 or 4 simple messages, people will hold on to them and they'll remember them. And that's a way of making sure that this isn't just a sort of pile of electronic words that sits on a virtual shelf. Just my thoughts.
And welcome thoughts as well. They are, Andy. Thanks as always. Always value your
Jason,
contribution.
I've been waving for some time.
I didn't even know you were here, Gerald. Sorry.
I have been here since you announced my name at the beginning and said I was here.
Oh, my apologies. Sorry. How time flies. Anyway, sorry I missed you. Yes, the floor is yours, Gerald.
Well, only to say I think I rather agree with Jeanette. In some ways, PCC is a deeply exasperating organisation that drives me and everybody else up the wall. But sometimes I have to step back, and sometimes I think I may be the wrong person to judge, because I'm so close to it that maybe I don't see the changes that have taken place, which I think are normally for the better. Thinking back 20 years. I think our relationship with the health service is completely different from what it was then, and significantly better. I think probably our relationships with schools now is very much better, even though academisation has mitigated against it. In some ways, we've managed to do very well in spite of government policy, not because of government policy. So I think there are bits that have worked better. The bit for me that worries me in the plan is around poverty, because there used to be the mantra that had at least a level of truth in it, that the way out of poverty for families was work, and I think that's increasingly untrue. That actually people can be working very, very, very hard and remain in real poverty, and that break, I think, is really worrying for the longer term, because it condemns people for never being able to escape. So that's that, and I'm not sure that we're able to do huge amounts about that. We can encourage higher wage employers to come into the city. We can encourage kids to get better educational attainment and exams so that they can get the better jobs, but overall that's a macroeconomic thing driven by government, and we have little control over that. But if this is a good piece of work, and it would be very disappointing if it just sits on a shelf and it doesn't make a difference to people's lives.
Thank you, Leader.
Chair, thank you for noticing me.
Actually, to correct you, you weren't here when I first called your name, so don't try and trip me up. You were,
No,
you were
I
a few
did.
minutes late, I believe.
Because Susie said straight after me when you called her that Gerald will be was coming in for the next meeting, and I wasn't there when you called the beginning of my name, but definitely the end of it.
Look, this is not a council meeting. Can we get on with
Indeed,
it?
you're right.
That's correct. Okay, have I missed anybody else? Any other speakers? Not that I can see. So, okay, we've got 5. The recommendations are in effect 5 bullet points. I think you can all see them there. I think basically the expressions that we've given so far show we're pretty united over this one. Can I just ask all those that are in favour, or maybe easy to say, is anybody actually against the recommendations? So, okay, there's no one actually disagreeing with them. Just to confirm, we're happy to accept those. Quick thumbs up. Is that okay? Right, fine. Thank you, everybody. That report is done. If we can now move on to item 6, which is the Portsmouth Adult Safeguarding Board Annual Review, pages 37 to 60. And David, I believe you're presenting this one.
Thank you, Chair. I think you've had the annual report for the board and a short statement about our new strategy. I'd like to offer you the thought, in the sense that the work of the Adult Safeguarding Board in Portsmouth is a subset, obviously, of the health and wellbeing strategy that you've just had sight of. And I'd like to kind of suggest, in a sense, that the board, the Portsmouth Safeguarding Adult Board, is potentially one of the vehicles through which some of the work of that strategy might become a reality. And I entirely take the point that Councillor Horton suggested about making that strategy a real working piece, if you like, in terms of the city. The Adult Safeguarding Board has been pretty busy over the last year, certainly in terms of coping with the pandemic, like everyone else, and had to adjust in a number of ways to the implications of the pandemic, not least of which was bringing a number of safeguarding specialists together in a weekly huddle in order to ensure that safeguarding work was undertaken. And we certainly shared through our website a number of pieces of advice to staff and volunteers around safeguarding. In addition to all of that, we've been beavering away in promoting interprofessional working, and certainly promoting the idea of multi-agency risk assessment throughout the year. We've taken part in a series of workshops on safer or safeguarding vulnerable dependent drinkers, which has been a really interesting process. The board's had around about 20 adult safeguarding review referrals, not all of which have resulted in adult safeguarding reviews. But interestingly, we are still working on 4 key cases, one of which, in fact, is going to be published today on our website, in respect of the death of a young woman who we've called by initials YL. So you might want to have a look at that later on. And we are also engaged in a thematic review of the deaths of a number of people who were homeless in the city during the first year of the pandemic. And if I might, Chair, offer a challenge to the board, really, in respect of restorative practice. And I'm being deliberately challenging here, because in a sense, I think being restorative with children is relatively easy. Maybe the real measure of whether or not the city becomes a restorative city is when we can do that with homeless people, or people who are drug users or substance misusers, because they're much more difficult to forgive in some senses. I'd like to bring to you later on in the year the result of that homelessness deaths review, because I think it may well add some perspective on the strategy that you've just been thinking about in terms of health and wellbeing, because it really does hit at the heart of safeguarding. We've also been working on a new strategy, which I think you've got some papers about, or a short description of, and our working action plan. We're keen, I think, to engage in a number of activities around wider engagement with service users, to do two things principally. One is to provide much better information for frontline practitioners to work together much more effectively. And to do the right things in terms of promoting positive relations and connectedness that I think, again, is in the strategy, the health and wellbeing strategy. We are really keen to engage frontline practitioners in that activity, but also a wider group of service users, using the intelligence from that engagement, but also to try to encourage more people in the city to be involved in the safeguarding of adults at risk. It isn't something, I don't think, that any particular place can just simply rely on its statutory services to do. We need a much wider group of people involved in that process. So we've set up a subcommittee, a subgroup of the board, in order to drive that work, and I hope in the coming months to be able to report back to you on the fruit from that labour, if you like. We also want to concentrate some of that activity on what we might call some of the forgotten adults at risk, certainly those who are homeless, substance misusing adults, dependent drinkers, and so on and so forth. We've been already championing the work of those young adults who are transitioning from children's services of one kind or another into adulthood, because we know that those transition points are moments of risk for a number of those young people. And we're looking to try to reshape the way in which the board works so that we can be much more user focused. And we've been trialling a number of ways in which, as a board, we can do that. So I offer you our annual report. I offer you the strategy that we've set out. It's an interim strategy and an interim plan, which we're going to evaluate in the next 12 months and work on from there on. I would like to invite you to make more use of the Safeguarding Adult Board in the city and to see it more centrally located in the health and wellbeing strategy. I think we can be of assistance in the wider context, and I would look forward to hearing from the board about the ways in which you think, as a Safeguarding Adult Board, we can do more things. So if there are imperatives that you think we should be engaged in, I would be really keen to hear them.
David, thank you very much for that. And just personally from myself, I'd certainly like to pick up a bit more with you on this one. So maybe we can get together at some point, and I'll get my secretary to contact you. Is that okay? But
thank you.
Thanks for that. Anybody else, colleagues, who wants to come back and make a comment in regards to David's report? Linda?
Thank you, Chair. It struck me the Making Safeguarding Personal case study about Charles in the report was just really powerful. I think a lot of people don't want help sometimes because they think we're going to do to them. And I think it's really important that we get the message out that we're there to help and support them in their wishes. And I think we'd get better engagement, especially with homeless, drug and alcohol abusers. They may not wish to stop their drug and alcohol use, but it's how we can make it safe while they do so. So yeah, really struck by that. And I think we need to focus on that more.
Yeah, fair point. Thank you, Linda. Diane.
Thank you, Chair. I just wanted to say thank you very much, David. I'm delighted to say, certainly from HUK Portsmouth's perspective, and I know other voluntary sector colleagues have enjoyed over the last couple of years a really growing relationship with safeguarding, the interaction with training, with policy, with understanding your way of working, and the sharing that's been going on has been absolutely terrific. And I'm actually quite excited to see the groups you're planning to set up and the involvement, and I would hope very, very much that if not all of us, then certainly at least the voluntary sector are very much involved with that, because the relationship is without doubt going from strength to strength. So thank you very much.
Thank you.
Thank you, Diane. Jacqueline.
It's just to echo what Diane said. I think in terms of having those restorative conversations and what Linda said, embedding them in all of our services seems really important. And the voluntary sector, in terms of support that it might give for those with substance misuse or alcohol dependency or emotional crisis or emotional illness, the voluntary sector, the likes of counselling, the likes of Age UK are often there to provide that level of support that will make engaging with statutory services either not necessary or easier. So that was my comment there. You're welcome.
Okay, thank you. I have no other indications for people wishing to speak. The report basically is for us to note. So can I say once again, thank you, David, for taking time to present that, and thank you for preparing the report. I look forward to speaking to you personally at some point, but I think on behalf of us all, thank you for that. Sorry, as you can see, I'm now back online thanks to the eventual IT support from PCC. Can we move on to item 7, which is the Safer Portsmouth Partnership, presented by Councillor Dave Ashmore and Sam Graves. Over to both of you. Are you still here?
There I am. Yeah. I don't know if you can see me at all. I'm having issues myself. Thanks, Chair. I was going to say, first of all, thanks to David Williams for providing the covering report, which sets out the recommendations here, and which was circulated to the partners with the papers. And it's important to understand, of course, that the Health and Wellbeing Board is the Community Safety Partnership, which is different in Portsmouth to other areas in Hampshire, and it fully integrates the community safety issues into what I believe, what Matthew said earlier in the ecosystem, the local ecosystem is there. It's, makes it joined up. When it comes to community safety and things like that, of course, a lot of people you find in the criminal justice system are there because of a variety of reasons that weren't picked up before. It might be some mental health issue that went undiagnosed, or they were failed on that, or they were victims of crime themselves, or they've grown up in abusive households, etc. So it's very important we have that integration there. And the constitution of the board was amended in April 2019 to enable that to happen, and for the board to take on the statutory duties of community safety partnership. So producing and approving this document is one of the most important. And there's 5 responsible authorities that come under the the Crime and Disorder Act 1998, which is the police, the council, health, probation, and the fire service. So they're all whom are represented on this board, and all whom are required to act together in active partnership. And address the evidence-based priorities set out in the report. So this is the first community safety planning cycle since the merger, since June 2019, and the priorities identified in this document informs the development of the community safety plan, which will come back to this board early next year, which also underpins the health and wellbeing strategy as discussed earlier in the agenda. And the document uses the data from the financial year 2020 to 21, and an update scan of key crime types will be undertaken just before the community safety plan is published in April 2022, and that'll make sure the priorities are accurate. So this document's a comprehensive one. It's full of useful statistics, and I recommend all partners to use it to guide decision making and resource allocation in the coming year. So without further ado, if I can hand over to Sam Graves to go through the detail with you now. Thank you very much.
Thank you very much, Councillor Ashmore. Thank you, Chair. I'm just going to put up on the, I'll put the slides up for you. Can you let me know if you can see them?
Yes.
Yep. Brilliant. Okay. Some of you will have already read either the draft of the exec summary or the draft of the full strategic assessment. And in that case, you'll be familiar with the fact that it is a very large document. It's about 100 pages. So this presentation is really just going to give a very brief overview of the strategic assessment. And really, I'm just going to tell you a little bit about why we do a strategic assessment and what one is. I'll include some impacts of the pandemic. As Councillor Ashmore said, I'll be giving you a brief summary of the main crime trends, and I'll also talk for a little bit about some of the recommended priorities for community safety. The strategic assessment process and the document itself are both statutory requirements for community safety partnerships, which is, as Councillor Ashmore said, is now a function of the Health and Wellbeing Board. We do the strategic assessments annually, and this strategic assessment was for 2021. The document itself is fully referenced. It brings together and summarises key research and analysis for crime, antisocial behaviour, reoffending, and also substance misuse, because historically the Community Safety Partnership also included the Drug Action Team. Uses data from a variety of sources, because a lot of data sources do have some limitations, and by using as many as we can, we try and mitigate those limitations. It considers how we in Portsmouth compare to other similar areas and to the national picture, and it looks at what happened compared to the previous strategic assessment, but also where data allows, we go back and look at long-term trends, 5 and even 10 years sometimes. The analysis in this document enables us to make informed decisions about what might be behind some of the trends. It identifies gaps in our knowledge, and it picks up the issues that are causing concern, so makes recommendations for local community safety priorities. The pandemic and the response to it has had a substantial impact on crime, community safety, and also the service delivery. The restrictions that were imposed during 2020 and 2021 significantly has impacted physical interactions, which has actually created fewer opportunities for some types of crime to take place, so those in public spaces. However, there's been a shift towards using online platforms for many of our needs, including working, homeschooling, shopping and socialising, which has created more opportunities for cybercrime and exploitation to take place. This assessment in particular focuses on crime and community safety, but COVID-19 has also led to increased job losses, higher unemployment and financial stress, which can have an impact on crime and community safety as well. And it's been experienced by people differently. So some people have become more part of their community, but others have experienced long periods of confinement and isolation or increased anxiety, which has led to exacerbated poor mental health. We know that for some people, alcohol consumption has increased, and we know that drug misuse has continued unabated, and it might be some years before the extent of the consequences are actually known. This slide here just shows, don't know if you can sort of see that this line here underneath represents the crime levels per month during 2021, and we can see that actually when we were in periods of lockdown, the red bits, pinky red bits, levels of crime were much lower than previous years. When there were restrictions, it's still a little bit lower, and this period here where there are no yellow or red bits is the summer period where there were very few restrictions, and we can see that the crime levels have returned to normal. So bearing that in mind, it's not really surprising that we've seen a reduction in crime recorded by the police in Portsmouth. There was an 11% reduction, which is consistent to what's been seen nationally. There was a 13% reduction. It's quite important to note for those of you who've read the report that the figures in the slide do differ slightly, because these are finalised figures from the Office of National Statistics, whereas the data in the draft report were provisional figures, which is why they're not public, and when it's been updated we will have a public version ready for that. despite the fact that there's been a lot of reductions in most types of crime, and that actually includes violence with injury and actually some of the more serious types of violence and many theft offences, there have been some increases in some types of crime. So stalking and harassment offences have gone up by 22%, and that relates to an increase of 483 offences. Shoplifting has up by 18%. Drug offences have increased by 10%. Robbery have increased slightly, 6%, which relates to 17 offences over the course of the year. Sexual offences have increased by 4%, and possession of a weapon offences by 3%. It is important to note, though, that these crime trends are based on police recorded crime. And so some types of crime are less likely to be reported to the police in the first place. So in particular, things like domestic abuse, sexual harassment, hate crime and online crimes. So now I'll just talk a little bit about the recommended priorities. This one isn't a new one. The full strategic assessment gives a lot more detail about why these types of violence should be considered for a priority for the partnership. But very briefly, although violence resulting in injury and more serious wounding offences have reduced, some types of violence haven't, and that includes domestic abuse, violence-enabled robbery and sexual violence. We recommend that domestic abuse continues as a priority because there have been year-on-year increases in crimes and incidents reported to the police, and that's been happening year-on-year for the last decade since I've been in my role. And we've also seen an increase in repeat victims since 2016-17. Domestic abuse accounts for 18% of crime and 42% of assaults. And for women are far more likely to be experience violence at the hands of someone they know very well. 63% of assaults against women were by partners, ex-partners or families, and only 11% by strangers. Most concerning, only 5% of domestic abuse crimes recorded by the police result in a successful court outcome, and this is down from approximately 11% in recent years. And this is due to a reduction in perpetrators being charged, but also cases being heard in court. With knife-enabled violence, overall knife-enabled violence has remained stable, and it is really important to know that although there has been a lot of media coverage about stabbings recently in Portsmouth, the police have done some recent analysis and found no actual increase in stabbings over the last 3 years. So overall, it's a crime type where there's potential for serious harm, but that doesn't always result in injury. But there has also been a 44% increase in knife-enabled robbery offences. So that was an additional 24 offences in 2021. And coupled with a slight increase in possession of a weapon offences and the potential for serious harm, knife-enabled violence should continue to be a priority for the partnership. The focus on sexual violence is recommended as a new sort of aspect to this priority, because in addition to the increases that we've seen since 1920, it's thought that sexual harassment and abuse is now so normalised, particularly for young women, that many of these crimes remain unreported. It's also a crime type that disproportionately affects young people. It's recommended that tackling drug-related harm is a continuing priority. The most recent local community safety survey in 2020 found that antisocial behaviour related to drug use was the most commonly reported antisocial behaviour type. So that's seeing people drug dealing, seeing people using drugs, or seeing drug litter. The proportion of the people reporting this type of antisocial behaviour to the survey increased substantially since 2016. So this is clearly something that's very concerning for our residents. Police intelligence has also suggested that county lines have adapted to the pandemic and that supply during the whole pandemic has been largely unaffected. And for those of you that have not really heard the term county lines, this refers to phone numbers being used in drug trafficking. And the intelligence included indication that there's been an increased use of online platforms to recruit and criminally exploit young people. Drug offences recorded by the police have also increased since last year. So it's important for the partnership to continue to invest and improve drug treatment so that we can reduce the demand for substances and thus reduce drug-related harm. It's recommended that early identification and interventions with young children and young people at risk of exploitation continues to be a priority. There's no single factor that can explain why some young people become a victim or a perpetrator of crime, but the more risk factors that are experienced and the fewer protective factors, the greater the risk there is of that young person becoming a victim or a perpetrator. We have seen encouraging reductions in overall youth offending, but there have been some small increases in some drug offences, and there was no reduction in robbery and possession of weapon offences despite all the restrictions that we've had over the pandemic. And going back to what I was saying earlier, there is concern that the increased use of online platforms, and particularly unsupervised access if parents have been home working and things like that, has resulted in more young people being vulnerable to exploitation. As previously mentioned, we know that young people are disproportionately the victims of sexual offences, but recent national research has indicated that this could be the tip of the iceberg. A recent Ofsted report found that sexual harassment and abuse was widespread in UK schools and colleges, and that girls and young women rarely reported it due to the worry that they wouldn't be believed or would be blamed, or that there would be repercussions from the perpetrator or their peers. So while we don't have local research, it is likely that the picture is similar in Portsmouth. We've been aware for some time that people with mental health issues are more likely to be victims of crime, and that there's also a complex relationship with being a perpetrator of crimes. And we've talked, I think somebody in a previous presentation mentioned about the relationship between poor mental health and using drug and alcohol, having drug or alcohol dependence, where if you use substances, this may lead to poor mental health, but equally, people may self-medicate if they're unable to get appropriate support. And we've noticed the data sort of showing that there's been sort of a more highlighting on this, where previously 50% of people accessing substance misuse services had mental health treatment needs. In 2021, 82% did. So that's quite a high proportion of people accessing substance misuse services. Sorry. So people have experienced the pandemic in different ways, but there's research to show that those who are already economically disadvantaged or those who had existing mental health problems were the most vulnerable to increased mental health problems. And there's other research showing that children and young people were found to have suffered increased levels of anxiety, but were often unable to access mental health care and support during the pandemic. And therefore, it's recommended as a new priority that improving accessibility and capacity of mental health provision for adults, children and young people becomes a new priority. The final recommended priority, and this is another new one, is to increase the awareness of cyber-related crime and how it affects our service users. So, I mean, over the last few years, there's been a gradual shift to taking daily activities online, with people doing their shopping online more and using social media. But the restrictions brought about by the pandemic have meant that even more people are shopping and socializing and things like that online, and people have been working from home online, children being homeschooled at various times during lockdowns, and often at the same time as the parents are working, so not able to provide that supervision. And so this has increased opportunities for criminals to access victims online. Reports of cybercrime have increased substantially during the pandemic on a national level, and it's thought that this is probably representing a displacement of some other crime types that were dependent on accessing public spaces. However, we know from previous community safety surveys that people often don't recognise some types of crime as crimes. Maybe they think that they're scams, but they're less likely to report them to agencies, possibly just reporting them to the bank if they've actually lost some money in that scam. So it's actually really important for partners to understand how this shift to online platforms is affecting the service users, especially since quite a number of services are actually providing some of their service online now too. So as we're asking the board to approve the new priorities, here are all the recommended priorities again, and the new bits are in red. So I'll just leave that up there for you for a second to have another look at them. And then if there's any questions, I'm happy to ask them. Also, I've got my email address up there, so if anybody wants to discuss anything after the session, the email address is on the slide. Okay. That's all from me. Thank you.
Thank you very much, and also thank you, Councillor Ashmore. To bring anybody else that wants to make any comments, perhaps any of our police or fire service colleagues. I have Claire first of all. Claire,
Thank you. And firstly, I'd just like to say a big thank you to Sam for the quality of the strategic assessment that she's pulled together. It is exceedingly detailed, and I think having just covered the agenda item around the health and wellbeing strategy, that the two couldn't be more aligned. And within the report, Sam has made many references to the causes of the causes within the strategic assessment. So the two really do fit together very well. I would reiterate everything that we talked about earlier in respect of how we do galvanise ourselves as a partnership across the systems, but really importantly with communities to start addressing those causes of the causes in a different way. Because if we don't, we simply cannot arrest and should not arrest our way out of these problems. So, Councillor Horton, I loved your anecdote that you gave earlier around that pocket of good practice that we just need to shout about more and more. But I just want to maybe give some clarity to a situation that we're currently dealing with as well, which we've got a partnership meeting about later on today, and this involves a series of street robberies which are taking place in and around Guildhall Walk and Charles Dickens and extending out to the broader city. And in amongst that group of children and young people, we have probably, I think, in excess of 40 children and young people identified now as being part of that group. And we simply cannot and should not be arresting all of those children and young people. Yes, there is a place to bring those that are the primary offenders to justice, but what we really need to do is have that shared understanding and situational awareness of each of those children and young people, the circumstances they're living in, what's happened to them to create this sudden change in behaviour, and it is a change in behaviour, and we need to work together to put the right interventions in place. And I hope that really will bring to life why we're talking about all of these issues today. You know, there's a lot that we can do as a partnership, and I think there is a lot to celebrate here in Portsmouth as well. And what I would say is our policing priorities are completely aligned to Sam's priorities and objectives within the assessment. So you know, I think that's a great starting point, that we all have that shared priority and shared understanding of what the risks are here for our communities. So I think building on that, one of the asks from the presentation for the health and wellbeing strategy was to actually seek sponsorship, if you like, from members of this board for each of the different priority areas. So I'm not sure if that's something that we're going to come back to, Councillor, in terms of that, but I would like to volunteer to be one of the sponsors for, I think the area that for me strikes a chord with policing is around positive relationships, looking at that restorative practice, particularly as we are really trying to prevent first-time entrance into the criminal justice system, and looking at out-of-court disposals and how we can achieve better outcomes for children and young people. Sorry, I've said quite enough there, probably.
No, thank you, Claire, and good to raise that point. We haven't really formulated how we're going to do that, but you've kindly volunteered, so I'm sure we're not going to turn down your enthusiasm, but we need to sort out basically how we can get that done. I don't have anybody. Oh, sorry, I have Kelly indicating at the moment. By the way, is Councillor Byrne-Jackson still here?
I am.
Oh, you are still there, Gerald. Sorry, I need to email you separately.
I am loitering.
Okay, Kelly, yourself.
Thank you. I'm just going to pick up Claire's point about the leads, and that's really great and helpful, and thank you. What we'll probably do is, rather than coming back to it at this meeting, is as part of the wider consultation process, we'll consult with people and come back with the nominated leads as part of the discussion when we come back in February or June or whatever we do around the consultation. But yeah, we'll pick that up offline with people. So if people want to indicate particular interest, or somewhere where maybe they don't want to pick up a whole theme leadership but have something they particularly want to contribute to it, that would be really helpful. And as I say, we'll just clarify that outside the meeting rather than revisiting it here. But thank you very much, Claire. That's incredibly helpful.
Yeah, thank you, Kelly. I have Joe and then Sam.
Yeah, thank you, Councillor. It was just to say really support the inclusion of the mental health and improving access and capacity in mental health provision as part of this strategy. I think it's really important, and the link is really important. It continues to be a priority within Health and Care Portsmouth anyway, and has been for a while, and we're continuing to look at how we can support and improve access to a range of mental health services, including the Positive Mind, and support to those lower levels as well as the more complex ends as well. So I just think it's a really good link to see it included in this. So thank you.
Thank you, Jo. Sam?
Thanks so much for that. And I forgot to mention, but it will probably be of interest to all of you as well, that we repeat the community safety survey every 2 years. So the last one was in 2020, and all going well, we're hoping to repeat that early next year, in about sort of the fieldwork in February, March 2022. We will be sort of advertising that and putting it out there so that people can sort of let their constituents know and be aware of the work that we're doing. But basically it involves, we train students up, they go out and they speak face to face with people in different locations around Portsmouth, and we usually aim to speak to around 1,000 residents to find out what their experiences are of crime and antisocial behaviour in their area. And it helps us get a better picture, because then we're not just relying on police recorded crime. We can also be aware of some of the stuff that doesn't maybe get reported in the first place. Okay.
Thank you, Sam. Jacqueline?
I was just going to say I really like the sound of that, Sam, because one of the things that we haven't touched on in this conversation, but I'm sure it will come up, is hate crime, which seems to be, perhaps that's one of the areas that's increasing, especially, and this is really sad, since the death of George Floyd. So it would be interesting to have those real conversations with people to bottom out what is happening there and what we can do as a system to try and understand and eradicate or minimise. So thank you.
Thank you. Jo, is that a historical hand, or do you want to come back again? Jo, can you hear me?
Yeah, no, sorry, mouse issues. Couldn't know. So I was historical hand. Sorry.
Okay. One person left to speak. Matthew.
Thank you, Joe. It's just to flag up. So I manage SAM now as part of our efforts to integrate our intelligence and analysis capacity within the council. But her role is funded by contributions to what was called the Safer Portsmouth Partnership pot, so from the responsible authorities for community safety. And those of you that contribute have contributed for a number of years, and that pot pays both for some targeted comms work, but also for the fantastic analysis that SAM produces in the community safety strategic assessment, and in the ongoing work around reporting against a number of key community safety priorities. So I just wanted to flag up that I will be in touch with you shortly, just to kind of review that process around that funding, hopefully secure your ongoing commitment to that work. And I think you can all see the value of the contribution that it does fund. But it will be me rather than Lisa, probably, who's done it in the past, that contacts you very soon about getting the money for this year, and potentially even an inflationary increase or two.
Okay, we have no one else has indicated they wanted to speak. I mean, thanks for everyone that has contributed. That was pretty useful, and I'm grateful for the enthusiasm that people have got to it. We have 4 physical recommendations under 2.1. I think, much like before, I'm not detecting much in the way of opposition to this. So, is there anybody opposed to us accepting the recommendations? Nope. Quick show of thumbs then, or hands, or waves. All in favour? Oh, that's carried. Thank you very much.
Excellent stuff. Thanks, Sam. I was just thanks, Sam, for the presentation there. Thank you very much.
Okay, thank you. Right, we now move on to our penultimate, which is preventing violent extremism strategy, and I have Rachel Roberts down to present that. Rachel.
Morning. My name's Rachel Roberts. I'm Deputy Director of Adult Social Care in Portsmouth, and I also have with me Charlie Pericles, who's the Hidden Harm Coordinator, in case there are any specific questions. I'm conscious of time, so I'm not going to go through the paper that was presented in detail. It was just to pull out a couple of key things, really. It was just to kind of to kind of remind the board that the Counter-Terrorism and Security Act 2015 placed responsibilities on specified authorities, and Portsmouth City Council is one of those, in the exercise of their functions to have due regard to the need to prevent people from being drawn into terrorism. So the kind of guidance highlights kind of three areas in terms of this activity, and that's having effective leadership, strong partnership arrangements, and appropriately trained staff. There are delivery benchmarks set against this area of work that the Home Office monitors, and they're in the paper for people to view if they wish to. They're generally speaking monitored through peer reviews kind of led by the Home Office. We have, as I said, strong partnership arrangements in place. We have good attendance and good engagement at our Prevent board, and also good engagement and attendance at our channel panel, and more specific details of the role of the channel panel is included in the paper. So currently the work is delivered operationally by the Hidden Harm Coordinator and Hidden Harm Education Officer. And the funding arrangements for those two roles are temporary. They were originally funded through the Home Office when Portsmouth was considered to be a priority area in relation to Prevent. It's not a bad thing that they lost that we lost that kind of priority status in terms of all the work that was done to reduce risk, but it meant that we lost the funding. So we were fortunate to be awarded funding through the EU to kind of deliver the Orpheus project, and there's a bit of detail in the paper regarding that. But I'm here today with just some recommendations. Now, the recommendations in the report are intended to ensure that the responsibility within the council at officer level for providing the strategic lead for carrying out the work of the Prevent duty is clear, and that future funding of the work is given appropriate consideration. So those are the kind of key points that I wanted to just raise, and then the recommendations are relatively straightforward, and there has been discussion prior to this meeting between adults and children and the directors within the council in respect of adult social care taking on the strategic lead for the Prevent duty, which would include operational line management for the delivery, sitting with the deputy director, which would be myself. And secondly, noting that I would need to link very strongly with the Deputy Director of Education to ensure that the service continues to be responsive to the needs of schools and colleges and children and young people in general. And the third recommendation is noting the funding comes to an end in December 2022, so there's work is needed to kind of identify future funding, and it's just to make people aware of that. So I'll stop and take questions if there are any.
Thank you, Rachel, and sorry, Charlie, for missing the fact you're also there as well. Any questions, any comments, anybody? There was no hands so far. Rachel looks like that's got a sailing endorsement because no one's querying it. No. As you rightly say, we've some recommendations to make on that as well. Can I ask colleagues again, anybody opposed to the recommendations? Nope. Happy to support then? Show of hands. Okay, thank you. That was short and sweet, Rachel, and that flew through, so well done on that one. Well, that brings us now to the actual final item for today, which is Better Care Fund Plan, pages 81 to 100. Jo, this is for you.
Yeah, thank you, Chair. So Better Care Plan will be familiar to this board. It is very much, I think, a business as usual way of working for us in Portsmouth, between the CCG and the council. And as we sort of outlined in the first item, it's really helpful for us to have those shared plans around support community-based services that avoid admission and support discharge. We've been asked by NHS England to submit a plan for this year, for 21-22. This came out in about September, and we had to submit our updated plan, or a plan, by the 16th of November into NHS England. It's it's a bit of an odd time frame. The last time we did this, we did it from 2017 to, I think it was 2019, and then obviously there was a gap because of the pandemic. We've continued to operate on the basis of that 2017 plan, and the Better Care Fund is sort of overseen by a partnership management group between representatives from the council and the CCG. So we had kind of continued and approved our plan from the beginning of April this year, and as I said, it feeds into how we use the money in a shared way to prioritise and support those areas where we best can avoid admissions or increase discharges to hospital, and we've talked about the South Sea unit within that. However, as I said, NHS England have asked us to submit our annual plan in November, which we have done. It updates sort of where we are and how we're using it, and it also there was also a requirement for some new national metrics as part of that Better Care Fund Section 75 agreement. Some of those national metrics are quite problematic in terms of collating and getting the data. We tend to use, they're slightly different from the data that we use on a day-to-day operational basis, and some of those new metrics, they haven't quite explained how they will be put through yet and how they'll be collated nationally. But I think the aim is to get a baseline as we move from CCGs into integrated care systems to see how those better care funds are performing. As I say, for us, we exceed as a CCG and the local authority the national requirement for putting into our better care funds. So we meet those targets anyway and exceed them. And as I say, for us, it's very much a business as usual. That open, transparent and shared alignment of funding is something we're looking to expand in the city as we move into the ICS to enable that continued focus of integration at place. So, yeah, that's why it's here. And any comments, or that the board are asked to approve the plan and the integration that is underpinned by it, really.
Thank you, Joe. Colleagues, any comments? Any points? Nope. Okay. Well, oh, sorry, Jacqueline.
Sorry, I was late to put my hand up. I've probably got, I think all of us, a good sense of the amount of integration that there is between the CCG and the council and actually across the board with other organisations. Because the Better Care Fund seems to be focused on the acute footprint, I wouldn't want us to lose sight of the other work that happens. Does that make sense? Where we are part of the early intervention work, where that is a big part of the strategy, which will fit in with what the Better Care Fund seems to be focused on. So I don't know if this captures the whole picture. You know, things like children's don't appear in this.
Oh no. So the Better Care Fund is quite explicit. There's quite as I say, it's quite restricted. Well, not restricted, but the way they monitor it nationally and requires minimum contributions. We, I think, have made a decision in some of the conversations we've had in the Joint Commissioning Board around leaving the BCF as it is in terms of those minimum contributions, which is very much focused on the community provision around admission, avoidance and discharge, but actually looking, and I think I came earlier, sort of probably maybe September, maybe July, around actually strengthening our overall integration between the CCG and the City Council with an overarching Section 75 framework, with then schedules that sit underneath that. So the BCF would be one schedule, and then there's a schedule for CHC which already exists. We have Health and Care Portsmouth commissioning team, which puts some members of our team under Section 75. Again, we're looking to strengthen that in an enabler, but also looking to see what we could have a schedule for children, possibly something around mental health and substance misuse, and also then around primary care and the public health grant. So this is just one sort of subsection really of the integration work between the CCG and the local authority. And as we say, we're doing that work now so that we strengthen the amount of aligned funding between the two organisations, so that we can really see really clearly how we spend the Portsmouth pound in relation to health and care in a single overarching framework, which is much simpler hopefully than as I've just described. We've got 3 Section 75s. They show bits of the picture but not the whole piece, and I think I'm very happy to bring that schedule back, the framework back at a point to the Health and Wellbeing Board, if that would be helpful, so people could see it, and that will, I think, show the broader health outcomes that we aim to achieve across the board. Does that answer your question, Jackie, and provide a bit more context on the wider work?
Yeah, and it's the context that I was really interested in, and I would find it incredibly helpful to see this within the wider context, because otherwise I fear that we're always going to be channeled along the AED, A&E route when there's so much that preventative work that we're also looking at.
I totally agree, Jackie. And actually, when we were looking at doing this work and increasing the funding between the two organisations that we put together, one option was to use the BCF, the Better Care Fund, as the framework for that. But actually, it doesn't really work. It doesn't really lend itself because of the national conditions. So that's why we've decided to have an overarching framework, and this would be one of a number of schedules within it, so you can see the specifics, but you also get that total picture of spend.
Thank you. That's really helpful, Jo. Thank you.
Yeah, thank you, Jo. You clarified that far better than I could have done. Do we have anybody else? As the time ticks towards 12 o'clock, we have no one else. So just in regards to the recommendations, again, as detailed by Jo, they're at 2.1 in the report. Happy to approve the recommendations, colleagues?
Yes, happy to approve them.
Thank you, Gerald. Anybody against? Nope. Okay, fine. Right, fine. Let me just move on to dates of the next meeting. The next meeting is scheduled for Wednesday, the 9th of February at 10 o'clock, which, if you recall, we agreed at the last meeting. There being no other business, can I just thank everybody that's attended today, and for those people that gave a presentation, a double thank you, and see you all on Wednesday, the 9th of February. Thank you very much, everybody. And sorry for my IT problems earlier on.
Bye-bye.
No worries. Thanks very much.
I'll close the live stream.
Thanks, everyone.
Cheers then. Bye-bye.
Thanks all. Bye.